10 or 15 years down the line, taking out all the fat underneath the eye to give a smooth contour leaves a hollow look, an empty look, and it's a dead giveaway for having had your eyelids done.
Right.
If you look at a young model, they don't have a concavity, they have a convexity to their lower eyelid. So instead of removing the fat now, we were redraping the fat in the lower eyelids to give more volume. And volume is the key to facial rejuvenation. Like I said before, my facelifts all include volume in the eyelid and malar complex. So it's so important, and so many people don't know that yet. The plastic surgery world is just really starting to realize that, and we're starting to see more on that now.
Right. I think part of it is that women realize that they lose a lot of weight, and as they lose weight, and we're all exercising more and losing weight, that you lose so much in your face, and it becomes an aging look. You may be in shape, but your face actually looks older because now you kind of like look sucked in and you look drawn, you kind of look sick. So you're right about the volume, because I've had patients say, well, I don't want to lose, I have 10 more pounds to lose, but I don't want to lose any more because now my face is starting to look drawn and it's not looking good.
That's right. So that's why we call the fillers the liquid facelift, the liquid lunchtime facelift, if you will. That's a way that you can, without surgery or putting off surgery for a few years if you want to. Ultimately, you're going to have to pay the piper. Ultimately, all the fillers in the world aren't going to improve on the inelastic skin or the muscles that are hypertrophied or the deep lines that just can't be filled anymore. So, and plus the cost of the fillers gets to be exorbitant after a while. So you have to eventually face the music and have the procedure or just abandon the effort.
Right. Now, what is the difference? Because I know there's Sculptra, there's Juvederm, Restylane. What is the difference? Because patients ask all the time, what do I suggest? And I just basically turf them.
Fillers like Juvederm and Restylane are hyaluronic acids. They're compounds that naturally occur in normal skin and tissue. And they last about a year. Sculptra and other things that aren't necessarily fillers, but when you inject them, they induce a collagen building response. Might last a little bit longer. The original use for things like Sculptra was for HIV patients who had tremendous facial atrophy and wasting.
Wow. And
they would regrow their collagen in the area of the cheeks. So it's another way of doing filling. And then you have the fat grafting, and then you have things that are more permanent. I would not encourage anyone to have free silicone injected into their face. I've seen too many cases where that migrates or comes to the surface, creating granulomas or low-grade infections that are lumpy and very difficult to treat.
Are people still doing their lips? Are they still doing collagen in the lips? You know, that Angelina Jolie kind of thing?
Sure. I do fillers in the lips all the time. There are certain kinds of fillers that you can do, and there are certain kinds that you shouldn't do. Just realize that sometimes lip augmentation is a fad. It's in style now. Mm-hmm. It may not necessarily be in style in 10 years. When you become a more mature person, you may not like the look, and if it's permanent, then you may regret doing it. So also there are more complications associated with the permanent implants. So I personally don't like to use those for those reasons, but I certainly would support a person's decision if it's well-informed. Go ahead and do it.
Right. Now, do you have a procedure where if someone doesn't seem quite right to you, do you require that they see a therapist if what they're asking for is unreasonable? I'm thinking about that cat lady in California.
So what you're really asking is, do I turn anybody away for plastic surgery, or do I have them see a psychiatrist if I think that they're
is unreasonable,
not quite there? Yeah. Well, everybody that undergoes surgery should understand what the risks and the benefits are, what the alternatives are, and the limitations are. They should be emotionally balanced and doing the surgery for the right reasons, not for somebody else, but for themselves. They should have a good idea about what they look like and what their emotional state is. And if they have ideas that they are very abnormal looking or see themselves as ugly when they're really not, then certainly those patients are going to still be at risk for feeling the same way after surgery, maybe even worse, because you've changed their identity. Self-esteem issues are delicate, but on the whole, I think that cosmetic surgery helps with self-esteem. I've seen many women transform from facial surgery, nasal surgery, breast surgery. They just feel better about themselves, and that translates into a better attitude and more positive confidence. So those are the things about plastic surgery that I really love, when someone comes back and I transform them into something that they want it to be. Yeah, not physically, but emotionally.
Right, and it goes hand in hand. I have a few young patients who are 16, 17, who are really uncomfortable with their breast size and have had breast reductions. And my first patient, I was kind of uncomfortable because I thought, wow, she already had picked out a plastic surgeon, and all I kept thinking was like, you're only 16. How could you make a decision like that? Without realizing the discomfort and the baggy shirts that she would wear, because I wouldn't view her that way.
Right.
But when she had the surgery, it was really amazing, because she suddenly became this confident, not big baggy shirt wearing person.
Right.
And it makes a big difference, and I bet it's got to be really rewarding, because you make an impact that people, and you're right, people might think that plastics, it's frivolous and it's vain, but I don't think so. I think you're making people feel good about themselves, even if it's just tweaking a little thing. People, for the most part, feel good.
Right. Speaking of the young women that we deal with, we like to put them off until they're at least emotionally able to make a proper decision. They're old enough to make the decision on their own for the most part. We rely a lot on their parents and their pediatricians and even psychological profiling to make the right decision. But young women, for their rhinoplasties, usually around 16 or older. Young men, 18 or older, because they haven't finished growing yet. For the breast work, generally wait till they're 18 before we make a decision on either augmentation or reduction.
Yeah, it's interesting. It's a fascinating field, because we tend to, like you said, think, oh, that's such a vain thing, and I think because we're so used to seeing the people who keep going and going and going and getting more things done, and getting bigger and bigger, versus the people who go because it makes a difference in their life and how they feel about themselves.
Sure. I mean, it could be something as simple as having your teeth whitened.
Right.
Or having braces put on because you have spaces between your teeth, or you have buck teeth, whatever. Those are the same issues. It helps your self-esteem to look better and feel better about yourself.
No, that's it's really invaluable, because no amount of exercise, getting in shape, no amount of knowing how well to apply your makeup makes those changes. And you can dye your hair, but if you're not comfortable with your nose or the shape of your face or your lips or your breast size, none of those things make you feel any better. And it becomes something, I think people then start to obsess, because that's all they think you see. You look at me and I think all you're looking at is that.
You triggered something in my brain for some reason. I'm thinking about the young mothers that have just finished having their children, something you said earlier. Their breasts have involuted, they've dropped, their tummies are not the same as they were 10 years ago. So there's a popular term now called the mommy makeover. which involves either breast augmentation or lifting and tummy tuck at the same time. And that's become a very popular procedure also. So
yeah, that
people need to get back to who they were.
It's, that's a whole issue with self-esteem. My sister actually had something like that done. And it's really funny because now whenever we have like family parties, it's totally different, the clothes that she wears, and she's so much more confident than she was before. And I think it's really important because I think women also will feel that their significant others don't find them as attractive, and that is a whole nother head trip that they have to deal with.
Right. Competing in the workplace is another reason. People need to keep their jobs. They need to look good, and they need to project a youthful, hip kind of attitude. And you can't do that if, first of all, you don't have the self-esteem to do it, and second of all, you can't compete with looks.
Right. Are you finding more men are also getting Botox and getting work done because of that reason?
Yes, absolutely.
I would think that would be...
They still lag behind the women in terms of the surgery, but they're doing the Botox and the fillers for sure.
Yeah, I would. How much of your practice is, with the Botox? How much is women and how much is men? What's the percentage?
It's still 90% women.
90%?
Yeah. The men are creeping up a little bit every year.
I think as we get older, and it becomes more okay, that men will. It's just like erectile dysfunction. Men never spoke about it until you started really seeing all these commercials, and then all of a sudden, you're having men easily come and discuss with you that they're having erectile dysfunction. If we start seeing commercials of men getting Botox, and that Juvederm commercial with the Y or the exclamation point or whatever it is,
right.
If they start showing some men, we'll get more men to knock on your door.
Right. So, not to change the subject, but maintenance.
Okay.
Maintenance for what we do. You can do facial, aesthetics. You can do chemical peels. You can do dermabrasions. You can put on some Retin-A. You can do some laser resurfacing or non-resurfacing, if you will.
So there's a lot that we can do before that.
With the fractionated lasers.
All
so
right,
there's no downtime with that. We have thermage.
David, I want to thank you for being our guest. And you can find David Pelaia here in Westchester, and he's affiliated with Northern Westchester Hospital. And thank you.
Oh, thank you for having me.
He does excellent work.
Thank you.